Welcome to TCM Board Formula Series. Today we review Ling San, 5-ingredient powder with poria. It belongs to the category promote urination and warm yang transformation. The herb photograph shows Fu Ling, prepared Wolfiporia extensis sclerotium. The fastest memory hook is this: when Bladder Qi-transformation fails, drain retained water while Gui Zhi restores movement of yang. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Ze Xie promotes urination and drains water accumulation. Fu Ling leaches dampness and promotes urination. Fu Ling drains dampness and supports the spleen. Gui Zhi strengthens the spleen and controls dampness. Gui Zhi warms yang and restores qi transformation. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Ze Xie. The deputy level is Fu Ling and Fu Ling. The assistants are Gui Zhi. The envoy role is Gui Zhi. Together, the formula promotes urination, leaches dampness, warms yang, and restores fluid transformation. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is Taiyang water accumulation with impaired bladder qi transformation. Look for this clinical picture: urinary difficulty or scanty urine. Thirst with vomiting after drinking. Edema, heaviness, or headache. Possible diarrhea or dizziness from disturbed fluid metabolism. The tongue is pale and swollen with a white slippery coat. The pulse is floating or deep and deficient, depending on stage. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Fu Ling Tang A Euro water retention with yin injury and heat signs. Zhen Wu Tang A Euro spleen kidney yang deficiency with more pronounced cold and weakness. Ling Gui Zhi Gan Tang A Euro thin fluid retention affecting the chest with palpitations and dizziness. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include persistent vomiting, inability to keep fluids down, very low urine output, confusion, or severe weakness requires urgent evaluation. Avoid unsupervised use in dehydration, severe renal disease, pregnancy, or unexplained edema. Monitor fluid balance, electrolytes, weight, and kidney function when clinically indicated. Modern medication review includes: the diuretic strategy may add to prescription diuretics and antihypertensives. Review lithium, renal medicines, and other drugs sensitive to fluid or electrolyte changes. Use a verified product. Document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. 5 ingredients. Number 2. Ze Xie is chief. Number 3. Urination and thirst. Number 4. Water transformation failure. Number 5. Differentiate from Fu Ling Tang. The one-line recall is, when bladder Qi-transformation fails, drain retained water while Gui Zhi restores movement of yang. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Ling San. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.